Everyone. I hope you can see me well. Special welcome to Professor Justin Robinson, who has joined us this morning. Special welcome to the representative of the Embassy of China, Mr. Zhou. Special welcome to the head of the Chinese medical team and his team that is with him. And I see also Dr. Worrell, the Delisle Worrell, who is the head of the Association for Barbados China Friendship. Welcome one, welcome all to the what must be the fifth celebration by the Confucius Institute of Confucius Institute Day. Something that we do each year around this time to celebrate the birth of Confucius and also the establishment of the whole Confucius Institute network. It seems like a very long time ago, but the last time we did this event, it was we had an open day and we also had a lecture by Dr. Chelston Braffett. And I remember that evening it rained very significantly. We had almost a flood-like condition in Barbados. This year we have very hot weather, so we can't complain when we get the rain and we get the sun. But without further ado, I would like to hand the floor over to Professor Robinson, who will say his remarks on behalf. He's representing the principal here today. I should say that the principal would have loved to join us, but she was otherwise engaged in chairing a major meeting today. So without further ado, I'd like to give the floor to Professor Robinson to say his remarks. Thank you, Professor.
Okay, thank you very much. Is everyone hearing me clearly?
Yes.
Yes.
Sure. Yes.
Okay, again, thanks again. So Counselor Mr. Zhuji, representing the Embassy of the People's Republic of China, faculty and staff of the KFL campus, co-directors of the Confucius Institute and staff of the Institute, officers and members of the Association for Barbados China Friendship, officers and members of the Chinese Association of Barbados, officers and members of the Barbados China Return Scholars Association, online participants, guests, ladies and gentlemen, and it would be remiss of me if I didn't give a special greeting to my dear friend, mentor, Dr. Worrell. Morning, Delisle. Hope you're well. Say hi to Monica.
His microphone is
Thank you. Good morning.
Good.
So first up, I want to convey apologies on behalf of the principal, Professor the Most Honorable B. Udine Barrett, who would have wished to be here, but she is chairing the meeting of the Campus Appointments Committee at this time. Now, Confucius Institute Day is celebrated on the last Saturday of September each year, marking the birthday of Confucius on September 27th. Confucius Institutes around the world organize activities to mark Confucius Institute Day, which was also instituted to celebrate the 10th anniversary of the establishment of the Confucius Institute as a global institution for teaching Chinese language and culture. On this day, around the world, all Confucius Institutes and Confucius classrooms hold open Chinese teaching courses, Chinese culture lectures, and a variety of Chinese language and cultural experiences. This year, at the KFL campus's Confucius Institute and its counterpart, we are celebrating in a vastly different environment from that of 2019. I'm pleased to report that the Confucius Institute at the KFL campus has adjusted well to the demands of the COVID-19 environment in which we now function. Going from a situation where hardly any of its work and activities went on online, the CI now has an enviable record of conducting a wide array of activities in a virtual environment, including the completion of classes and exams for the UWI-CH China Institute for Information Technology students, a very important program for us here at the KFL campus, a virtual graduation for these students from Chinese classes, the completion of evening classes, its annual board meeting with our partner university, the China University of Political Science and Law, a review and planning meeting with the Confucius Institute Regional Office in Santiago, Chile, and other hemispheric counterparts, and regional examinations for the HSK, the standardized test for Chinese, and a range of activities. So the CI at the KFL campus has continued to adapt during these difficult times and is emerging as a stronger and more flexible institution. It is honing the techniques for what is called a high flex approach to teaching via face-to-face classes that meet all COVID-19 protocols, as well as online, synchronous, and asynchronous teaching. Indeed, the adoption of these online technologies has opened new horizons for the Confucius Institute for its future work. I hasten to add, however, that face-to-face is the preferred mode. And so it is today that the Institute embarks on the celebration of Confucius Institute Day for the sixth time since its establishment in 2015. While in previous years, this has been done face-to-face, it has to go online. And during the course of the day, you will have the opportunity to participate virtually in a number of exciting activities, including a presentation by the 4th Chinese medical team on life and work in Barbados. And I must add here that the KFL campus looks eagerly towards the day when cooperation may be activated under the MOU between the KFL campus and the Chongqing Medical University, which has provided the doctors and nurses which comprise the 4th China medical team. That cooperation in that manner has been delayed by the onset of COVID-19, but we look forward to commence some of the activities remotely until face-to-face cooperation can commence. There will also be a demonstration of Tai Chi, an ancient Chinese tradition practiced today as a graceful form of exercise and for the purposes of relaxation, which are vital in these stressful times. Performances by local contestants in the first online talent contest organized by the CI Regional Center for Latin America, and the CI newest activity, the one person, one dish demonstration, which explores the differences and similarities between the culinary traditions of China and the Caribbean. I take the opportunity to extend best wishes to the CI and all online participants as you embark on this virtual celebration. For me, it's a personal pleasure. I am a person who embraces our multipolar world and very excited and pleased that China has taken its place as one of the major powers in the world. So I always look forward to our cooperation and activities with China. I thank you and wish you the best in today's activities. Thank you.
Thank you very much, Professor Robinson, for those words of inspiration, and thank you for taking time from your busy schedule to be with us here.
And please forgive me if I turn off my camera to protect the limited bandwidth as we do this high flex.
That is in fact one of the things that we are learning about. There are many new experiences in working in this online environment, that when you have so many people online, then you get reduction in the quality or connection that is taking place. But as I was saying, thank you very much, for Professor, for taking the time to be with us this morning. We have before us, as you mentioned, a fairly packed and exciting day. And this day is a continuation of our efforts to promote better understanding between the Caribbean and China, and to spread information about Chinese culture and the Chinese language. So thank you very much for being here with us. And feel free to stay with us or come back in and join us at a different point during the day based on your schedule. I know a number of persons have indicated that they will do that. So well, we may start out with fewer than a larger group. I think we have something in the program for everyone, and we expect others will join us during the course of the morning. With those introductory remarks behind us, I would now like to start off the remainder of the program by giving the floor to Mr. Dr. Wei of the Chinese medical team, who will, I believe, at first introduce the other members of the medical team and then give us an overview of what he plans to present to us in his segment, which is dealing with their work and their life in Barbados. Thank you, Dr. Wei. Over to you.
Okay, thank you, Mr. David, and good morning, Professor Robinson and Counselor. And first, I will show my appreciation to all of you to give the help for the 4th Chinese medical team. And actually, till the last week, we have stayed in Barbados for 1 year. So in this year, we have a memorable experience in Queen Elizabeth Hospital and in Barbados. So today we will share our work and life in Barbados. And I think I will introduce our team members in my lecture. So I will first show my so may I start the presentation?
Yes,
Or
please.
someone else will give us a speech at first? Mr. David? Or shall we start the presentation? Or
you can start the presentation. I believe, yes.
Will the Counselor Zhou or Miss Lee say something?
No, it's okay.
No?
Yeah, you go ahead.
Okay.
Yeah.
Okay. 周参，您说2句吗？
我就不说了。No, you can start directly.
Okay. So let me see. Okay, can everybody see the screen clearly?
Yes, I can.
Oh, okay,
Yeah,
no problem.
No problem.
Okay, thank you everyone, and thanks for the opportunity for us to introduce our work and the development of our specialties in this morning. And actually, we start our work in Barbados from the September last year, and have spent a memorable year in the hospital. And our group consists of 6 attending doctors and 2 nurses. And our specialties include the anesthesiology, cardiology, Chinese medicine, and nephrology, neonatal ICU, orthopedics, operation theater, and ultrasound. So till now we have stayed here for 1 year, and our members are from the hospitals of Chongqing, and one of the 4th municipalities which has directly administered by the central government of China. It is also the biggest city in West China with a population over 13 million. That's a horrible number, I think.
Mm-hmm.
And it is also the called mountain city for most of the area crossed by rivers and mountains. So it's different, totally different with Barbados. So we have never seen a sea before we have never seen a so beautiful sea before we came here. And I worked in the first affiliated hospital of Chongqing Medical University. And I think 5 members of our team are from this hospital. And it has a history of more than 60 years. There are 35 departments and divisions, and 3,200 beds and more than 5,000 staffs and about 2,000 residents and fellows in this hospital. So far, 7 doctors in Barbados have worked in our hospital. So I wish we would have opportunity to get more staff exchanges between the two hospitals. And my major is anesthesiology, and our department has more than 200 doctors and nurses, and we have over 14 operation theaters and finished more than 150 cases per day, and is excellent in patient care, education, and research. And there are 10 subspecialties in our department, including the following subspecialties, and that is clinical anesthesia, and also the control of the chronic pain, and also the acute pain after the surgery. And today I will share a clinical program in our hospital to all of you. That is called the ERAS, Enhanced Recovery After Surgery. It's proposed in 1997 by a Denmark surgeon, Dr. Henrik Kellit. It is a multimodal perioperative care pathway for major surgeries. And the aim of these evidence-based protocols in this program is to reduce the post-operative complications and facilitate the recovery from surgery. And all of these protocols are aimed to controlling the surgical stress response and optimizing the physiological function. And ERAS program includes protocols for all phases around the surgery, that is pre-hospital, pre-operative, intraoperative, and post-operative, and also discharge and post-discharge phase. I think the phases around the surgery is the key to a successful implementation of this program. During pre-operative phase, one of the notable changes is that instead of overnight fasting, as we know that the routine fasting time is 8 hours before the surgery, but now, according to the ERAS protocol, intake of clear water is allowed until 2 hours before the surgery, before the induction of anesthesia, especially the fluid loading with complex carbohydrates, which is proved to be benefit for promoting the recovery of the intestinal function. In view of the intraoperative protocols, the key point is for analgesia, appropriate anesthesia death, low opioid consumption, and a minimal invasive surgical path. And during the post-operative period, prevention of delirium and ileus are valuable for a better outcome, and a series of measures are proved to be helpful for bowel movement. For example, ask the patients to have gum chewing and restricted the fluid infusion and early feeding, and early mobilization, avoidance of excessive fluid infusion. Moreover, and prophylactic and routine use of nose gastric tubes is not recommended anymore.
Sure.
And according to our experience in ERAS, collaboration of multidiscipline team, multimodal perioperative care pathway, and the compliance with the ERAS protocols by the patients as well as the healthcare providers is important. And the conception of ERAS is accepted by Chinese doctors from, I think, 2007. And after 13 years, it is now popular used in most of the Chinese hospitals, and more than 10 guidelines for ERAS have been issued by various specialty societies in China. And as to our hospital, and we start the work at 2015, and now it is commonly used in gastrointestinal, orthopedic, and some other major surgeries. And every year we finish about 2,000 cases by ERAS protocols, and it presents confirmed advantage in facilitating the patient recovery. And now we are trying this program in more surgery types. And at last, I will show a patient that is treated with the ERAS protocols for hemicolectomy. This gentleman is 70 years old, and after 2 hours after the surgery, he took water, and at 6 hours he trying to sit up. And the first day he can have mobilization, and the whole hospital stay is only 6 days. So that's all for my brief introduction of our work in ERAS program, and hope for further cooperation and communication with the doctors in Barbados in this field. Thank you. And I think the next speaker is Dr. Jenny, Dr. Wang Jing, from the Department of Ultrasound. Jenny, are you ready?
Yeah, good morning, everyone. I'm here.
Good
I'm
morning.
Jenny.
Hi.
Morning. Hello.
Good morning. Okay, just wait a minute. Okay. Let me play my PPT. Yes. Okay. Good morning, everyone. I'm Dr. Wang. You can call me Jenny. I come from the ultrasound department, affiliate about of the radiology department. Today, I want to share with you the medical ultrasound and my work at the UWI-CH. The medical ultrasound, also known as diagnostic sonography or ultrasonography. Ultrasonography is a diagnostic imaging technology based on the application of ultrasound. It is used to see the internal body structures such as tendons, muscles, vessels, and some internal organs such as the liver, gallbladder, kidney, spleen, and the bladder. And its aim is to often to find the source of the disease or to exclude alien pathology. The ultrasound examination benefit from the modern medical imaging, such as we know the X-ray examination, MRI, CT, and the radiolacunide scan. The ultrasound is a branch of the modern medical imaging. At first, we will talk about the clinical applications of the ultrasound examination. And this ultrasonography is widely used in the clinical work, and it is possible to perform both diagnosis and therapeutic procedures. It can effectively application for imaging some soft tissues of the body, and we can use ultrasound to guide interventional procedures, such as some lump biopsy. For instance, the breast lump biopsy or the thyroid nodule biopsy, to help the doctor to get some pathological diagnosis for the patient. And sonographers typically use a handheld probe we call the transducer that is placed directly on the surface of the body on this a probe to surface on the patient's body and moved over the patient to let us to get the quality image of the body's internal organs. And sonographer is effective for imaging soft tissues of the body, such as I just said, the muscles, tendons, eyes, thyroid, breast, gallbladder, liver, pancreas, spleen, and kidneys. Let me show you some ultrasound image to you. This first one just shows the ultrasound image of the liver. In this picture, we can see the liver and the hepatic vein, and just show the internal organs. This picture just shows the sagittal plane of the gallbladder. In this picture, we can see the lumen of the gallbladder, wall of the gallbladder, and the echo of the liver, and the common bile duct, and the portal vein. If we have some stone in the lumen of the gallbladder, we can show a strong echo in the gallbladder, so help us to diagnose the disease and find the pathology of these organs. This picture just shows the right kidney. In this picture, we can see the cortex of the right kidney and the renal pelvis. If someone have the renal stone, we can show the picture to distinguish the strong echo in the pelvis. And if have the cyst or the other mass, such as the carcinoma of the kidneys, we can use this picture to show the abnormal structure of the right kidney. And this picture, the two pictures just show the sagittal plane of the bladder and the transverse section of the bladder. We can rule out the stone in the bladder and some mass of the bladder to help us to the diagnosis. And this picture just shows the eye of our eye to show the structure of our eye and to find the abnormal structure. This picture just shows the female's breast, the hypoechoic lesion. In this area, the hypoechoic lesion just shows a lump of the breast. This picture just shows the structure of our thyroid. We can show the here, just the common carotid artery. Here show the thyroid structure, and here show the range pipe. As we know, the nodule in the thyroid very common, and follow the advance of the technology of ultrasound application, we can find some small nodule in the thyroid and help the patient get the early stage diagnosis and treatment. This picture just shows some pregnant female to get the prerenal ultrasonography examination within the early stage pregnant or the to find some malformation of the fetal. And through the three-dimension examination, we can see the surface of the fetal, and we can see the face of the baby. In this picture, we can show the eye, nose, and the mouth. So through the imaging of the ultrasound, we can find some malformation of the baby. And this picture just shows the vessel. The anechoic lesion just shows the vessels, include the artery and the veins. Use the color Doppler, we can show the blood flow within the lumen of the vessels. We can show this picture just shows the carotid artery. We can show that if have some plaque or the stenosis in the arteries, we can use the color Doppler to show the color defect in the lumen of the artery. And this picture just shows the veins, shows our lower limb vein, the color field in the veins. So this picture just shows the dynamic show of our abdominal aorta. We can get the real-time image of the aorta, and if have the aneurysm or the stenosis or plaques in the aorta, we can get it. And this picture just shows the one patient's right lower limb. We can get the color Doppler flow within the artery and the veins. At first, I just show you we can use the ultrasound guide to do some interventional procedures. This picture just shows the under the ultrasound guided, we can insert the needle into the muscle and with the insert into the vein. And this picture just shows the guide wire through the needle insert into the vein. And after the we plant a catheter into the vein, we can help the doctor to get some treatment for the patient. So now we can talk about some advantages of the ultrasound. At first, it shows the real-time imaging to show the situations, and just show the live images where the operator can dynamically select the most useful section for diagnosing and documental changes. As we show, I show you the some ultrasound images. We can get some image for the patient. Often enable, we can help the doctor to get the rapid diagnosis. Live images also allow for ultrasound guided biopsy or injections. And through our ultrasound examination, we can show the structures of the internal organs. And in our department, the examination room, we have the machines and with the portable machine, just like our laptop, the size just like laptop. We can use this machine carried to the bedside to get some emergency or the serious conditions. We can use the bedside examination for the patient to get the rapid diagnosis. And relatively, the other mode of the investigation, such as the CT, MRI, and the other with our ultrasound examination, have the lower price for the patient and the benefit for the patient more. And as we know, it has no long-term side effects and rarely cause any discomfortable to the patient. So through the use of the ultrasound research, an ultrasound device can offer a relatively inexpensive, real-time, and flexible method for the patient. But ultrasound examination have some weaknesses. And sonographic devices have trouble penetrating bone. So if we met this condition, it's very difficult. And the sonographer performs very poorly when there is a gas between the transducer and the organ of interest. For example, makes ultrasound scanning of the pancreas difficult, or the lung imaging is not possible. And the physical, such as some obese patients, we can't get good quality image. And this rate just has a large influence, operator dependent. A high level of skill and experience is needed to acquire good quality images and make accurate diagnosis. So now I will show some pictures with my work at UWI-CH. The first one shows the radiology and medical images, the door of our department, and the ultrasound suite just affiliated with the radiology department. This is during my work, we just get the good quality image for the patient of the thyroid examination. And this picture shows a patient after the operation in the recovery room. I use a portable machine to get the bedside examination for the patient. And in the intensive care unit, the patient is very serious. And in this condition, we can use the bedside examination for the patient, because the patient can't be moved to our department. And this is my work. Doing my work, I have some. It's me and my patient take a picture with them. And the last picture just show my colleagues, in my department, some senior hospital officer and the training doctors come from the emergency department. In Barbados and at UWI-CH, we had spent a good time with my patient and my colleagues. I love the kindly peoples, and I love my work in my hospital. So thank you for your attention. Thank you.
Thank you. Thank you very much. Dr. Wei, we have another presentation.
Yes, the next one is, let me see.
I think it's
Dr.
P.
Chow.
Yes.
Yeah, traditional Chinese medicine.
Okay. Good morning.
Morning.
Good morning, everyone.
Before you start, if I may, I see we have been joined by Mr. Selwyn Smith, who is the head of the Consular Corps here in Barbados, the head of the Consular Corps in Barbados. He's the Dean of the Consular Corps in Barbados. Welcome, Mr. Smith.
Welcome.
Good morning.
So I can begin?
Yes, please.
Okay. Good morning, everyone.
Good morning.
I'm Dr. Chiao. My presentation is acupuncture in Barbados and China. This is the hospital where I worked in China and Barbados. And this is a view of my hospital, both China and Barbados, the view of day and night. And some beautiful view in UWI-CH and Chongqing Hospital of Traditional Chinese Medicine. This is my office in China and Barbados. And this is the ward and the outpatient clinic. This is a places where patients do their treatment. This is a patient in China. They are doing Max Besting. And this is a student in China and Barbados who I'm teaching now. And this is a daughter of my colleague in Barbados who learned the traditional Chinese medicine in China, in Shanghai Traditional Medical. And because she couldn't come back to China, so she come here to learn from me to learn cutting, acupuncture, massage, and others. This is the normal working in my daily life. So, what is acupuncture? Acupuncture is great invitation of Chinese nation. It is one important means of human health and protection. It has been practiced in China for over 4,000 years. Acupuncture is a needle, like this. And see, like this. Under the guidelines of Chinese medicine theory, according to certain angle to press into the body of the patient. Acupuncture theory is a meridian system. It consists of meridians, collateral, and subsidiary parts. This is the model of meridians and acupoints. Meridians is one of the important components of traditional Chinese medicine. This theory has been formed and developed in ancient doctors' long-term practice and has guided the diagnosis, treatment, and application of all the branches of subject of TCM. So what can acupuncture do? Acupuncture as normal, they think they are magical. But what can acupuncture do? Acupuncture is a form of drug-free of treatment. It is key component of TCM. It is the intangible culture heritage in the world. Generalized acupuncture including acupuncture, most best, etc. So what disease can acupuncture do? And the World Health Organization has designed more than 40 different diseases, such as stroke, anxiety, asthma, and all kinds of pain, nausea and vomiting, and insomnia, addiction, depression, and such as the normal postures of acupuncture, including 6 postures. The first is supination, then pronation, side sleeping, supine sitting, prone sitting, and side sitting. Acupuncture has different treatments. The first is the normal acupuncture with needle. You can see like this. I can do like this one. Okay, can you see? I do in my Hegu point. That's acupuncture. Acupuncture has different sizes. This is one point. This is a longer needle, very longer than this one. You can see that's very long. You can also use it here. I have 2 needles in my hand. This is a long one, and this is the shorter one. Okay, this is acupuncture, and sometimes we don't only use acupuncture. We use acupuncture with electro, like this. Like this one, this is electron machine. Just like the third picture. To make the patient feel more, have more feelings about the acupuncture, to make it works very well. If some disease, such as the pain, is very deep under the skin, we use the moxibustion and needle together. This is moxibustion with together. Then to make the disease become better. So this is the first acupuncture. And the first picture you can see, this is me in the dragon and the fish and the dragon festival. I do acupuncture for the patients who come here.
湿疹 eczema.
And the second treatment in traditional Chinese medicine is moxibustion. This is moxibustion. I do some treatment before. We can use this one to warm the places It can be for chronic pain, acute pain, and headache, and who always feel very, very sick, but you can see anything changes in their body. We can do like this. This is, then we do like this. When it burns, then we do it in the places where need. Do not touch the skin. It will burn the skin. Sometimes we not only use the moxibustion, we contribute with ginger, salt, and other drugs together to make the disease become better. That's the moxibustion. And the third one is cupping. Cupping is very, very normal. We have different size cups. The little one, big one, so I can do cup. Oh, how can you do it? Oh, this. If I do pack. Oh, sorry. You can see I can do pack. That's cups. It can suck in the skin. This is cups. Mostly do not do cups more than 3 times a week, and do not do once, do not more than 10 minutes. The next one is air acupuncture. Air acupuncture is very, very helpful for the insomnia spirits. You like this? First, then press. Press 3 times and every day, morning, afternoon, evening, 3 days once. Then you can take it off. It's very, very helpful for insomnia, painful, and addiction. Then is massage. Do massage for the shoulders, because shoulders always feel pain when you work for a long time. And other treatments, including paste, acupuncture injection, and catgut embedding, and others. Do acupuncture isn't just normal like it has special skills. For example, the first picture, we should put the needle from this side to other side. And the second we need is to let the skin as high as you can to make the skin. How to say that one? And the third one is under the knee to make the legs jump like this for 3 times to make the stroke patient to work very well. That's all. Thank you.
Thank you very much. Dr. Wei, if you may permit me a minute, I just wanted to welcome Dr. Damien Kohal. I believe he joined during the last presentation. I saw his name before, and still, yes, Dr. Kohal is there. He is, of course, as you know, the Deputy Dean in the Faculty of Medical Sciences. So I just want to give a special welcome to Dr. Kohal.
Thank you, David. Thanks, everyone. I've been listening to the presentation so far. All have been quite captivating, and I'm happy to share in the discussion section that may be soon very eminent after all the presentations have been concluded. Thank you.
Okay, back over to you, Dr. Wei.
Okay, thanks, Dr. Debian, and nice to see you again. And the next speaker is Dr. William, that is Dr. Sui Wei from the Department of Orthopedics. Welcome.
Dr. Qiao. Dr. Qiao, please cancel your PowerPoint. 退出。
Okay.
Okay. Okay, good morning, everyone. First of all, I want to thank Confucius Institute and Mrs. Lee and Mr. David for the opportunity to address friends in Barbados. It's my pleasure. So they have introduced work in China and Barbados. So in my term, I will be in charge of life. As you know, most of the doctors and nurses in our team are from the affiliate hospital of Chongqing Medical University. There was very good news that several months ago, the MOU was signed between the University of the West Indies Capital Campus and Chongqing Medical University.
Yes.
That means these two universities have been partner universities. So today, I want to introduce a study and culture tour program in Chongqing in CQMU. It also will be a very good communication method between the medical students of CQMU and UWI. These are the picture of the tours of recent years. You can see there are different colors of t-shirt each year. It's very interesting. The tour was in spring every year. Everyone knows that it was canceled this year because of COVID-19. Hopefully, the program will be restarted next spring next year, but will depend on the epidemic situation. CQMU is at the city of Chongqing. Everyone knows that, which is municipality is located in southwest China. This city, Chongqing, has 3,000 years of history and modern buildings as well. Chongqing Medical University is a famous medical school in China, which ranks from 10th to 15th on the Chinese medical university list. So what you can study from this program? You can see the picture. The Chinese traditional arts, the medicine and the related areas, and the traditional culture of China, and the local culture of the Chongqing city, also the culture of Chinese family. So who can join the tour? The students and faculty members from partner universities in different countries, and volunteer students and faculty members at CQMU. So we are very confident that the tour will be a lifelong memorable experience for all the participants. This is feedbacks from the participants. This is proposed schedule of this program every day. There are 5 course packages of this program. The first one is a tour of HIFU Technology Center. HIFU is high intensity focused ultrasound treatment, which was invented by CQMU. And this technique is very, very famous in the world. And package B is mass spectrometry workshop. I think it's a laboratory tour. And package C is traditional Chinese medicine. I think that will be a very mysterious experience. And package D is prevention of oral diseases. You will visit the CQMU hospital of stomatology. The package E is Chinese hospital management. It is tour at the second affiliate hospital of CQMU, which has very modern medical facilities. The picture has shown this. The program fee is about $700, but it's very good news that for the medical student in UWI, that the participants from CQMU's partner universities will be sponsored by CQMU in the tour. So as I have mentioned before, CQMU and UWI have been the partner universities several months ago. But the cost does not include the airfare with us, spending money, meals, and any other personal expenses. So if you are interested in this program, you can email the contact person to ask for some further details. Here is the address of the email. So finally, I want to say welcome the medical faculty members and the students in UWI, China, to CQMU to experience the traditional culture and modern medical education. Thank you very much. Thank you.
Thanks for Dr. Williams' presentation. And our next speaker is Dr. Pei Xinlin from the Department of Nephrology.
Good morning, everyone. It's my honor to be here to give you this presentation, share this information about the characteristics and traits of kidney disease in China. And we share some of this information in this year's World Kidney Day in UWI-CH. First, let me can show you some picture about the departments in China. Here is the hemodialysis center in our hospital, which contain about 100 beds and provide 600 patients with hemodialysis treatment. And patients use information system which can check their blood pressure themselves and weight them and do the dialysis treatment themselves. And our department has one doctor and 2 nurses who have went to Barbados before, and Dr. Gong and Nurse Wang Xianglei is the first team member of the Chinese medical team to Barbados, and Nurse Yang Liu is come with the second Chinese medical team to Barbados. And The information I share today, some of it I share it on this year's World Kidney Day in UWI-CH. Okay, let's go back to our topic, and it's a short presentation. And in 2009, China launched a nationwide survey was conducted, which was indicate that about 10.8% of the population has chronic kidney disease, but among them, only 12.5% of the people know that they have this kind of disease. That means the high incidence of chronic kidney disease, but the no awareness of the kidney disease. This article was the first survey about chronic kidney disease in China, and it was published in the Lancet magazine. In 2009, China launched a new round of healthcare system, which currently more than 95% of China's population are covered by the basic health insurance provided by the government. And based on the database system, we can get more data from this from our country. And the China Kidney Disease Network, which was founded in 2014, began to publish annually disease report based on the data system. The first edition of China Kidney Disease Network published the annual data report of 2014, which was published in the supplement of American Journal of Kidney Disease in 2017. And the second edition of the data report was published in the Kidney International supplement in 2019. The information I mentioned later are mainly from the second article. From the article, we can see that the patients with CKD constitute about 4.8% of all the inpatients. The percentage was higher among those with non-communicable chronic kidney disease, especially diabetes. And the percentage increased with age gradually. The percentage reached 9.69% for those aged 85 years old or older. And this map shows the causes of the chronic kidney disease, and the top three comes to diabetes, hypertension, and primary glomerulonephritis. We can observe that there is an increase in the percentage of hospitalized patients with CKD from 2010 to 2017, and the percentage with chronic kidney disease due to diabetes, which exceeded that of kidney disease due to glomerulonephritis since 2011, and the gap between them gradually increased. About 23.6% of patients with primary GN had a pathological diagnosis in China, and the top one reason of GN is IgA nephropathy. Okay, next part I give a short information about the prevalence, incidence, and character of dialysis patient. The number of dialysis patients in China in 2005 is 11,600 197, which with a character of male predominance, and the mean age was 55 years old, and with hemodialysis was a major mode of dialysis. There is much more less PD patient in China. And this shows the waiting list and the number of candidates in China. We can see that in 2015, there from January the 1st to December the 31st, there are 20,321 candidates on the waiting list, and among which 9,259 candidates were newly added to the waiting list during the period, and 5,151 candidates were removed from the list during this time period. And among the 5,000 patients, about 88%, 7%, about 4,500 patients received a kidney transplant. And among all the candidates, the waiting time was about 17 months. Okay, this is the short information I want to give you for today. Thank you for hearing.
Thanks, Dr. P. And let's invite the two nurses. Who is the first? And I think, Miss Zhou Caohui, to introduce her work in the operation theater. Please welcome.
Yes. Good morning, everyone. My name is Zhou Caohui. I'm an operating theater nurse. Today I will share the hand wash with you. The outline of the course contains 4 items. The first is background. The third is term and definition of hand wash. The third is hand wash indication. And the fourth is hand wash procedure, which is the major content. So we need to master hand wash procedure. The most breaking news must be COVID-19 epidemic in 2020. The virus transmitted all over the world. We can concern the data update every day. The concern cases and the death cases and the recovery cases. By several months fighting against virus, WHO recommends protocols to follow, which contains at least four steps. The first is hand wash and wear a mask and keeping social distance. Due to short of I'm so sorry. So due to short of the mask, the hand wash is the most important measure to resist virus. So we need to master hand wash. Maybe someone will tell me, she can wash hands when he was a kid. But do you know when to wash hands? Can you wash hands correctly? Or when you need to wash hands and how long you need to wash hands? What are the supplies you need when you wash hands? So we need to know what is hand wash. The definition of hand wash is People wash hands with soap and flowing water when visibly solid, and within 40 to 60 seconds washing hands. Someone also told me he can wash hands without water. So we should remember the key points of wash hands. Soap and flowing water and visibly solid. If you just use the alcohol sanitizer to clean your hands, that is hand wash, and the entire of the duration procedure is 20 to 30 seconds. So wash hands when you visibly solid. Otherwise, use hand wash. Before we start to wash hands, we should check the supplies are available. The first aid, the sink, the soap, and the towel, sometimes maybe the tissue, and the cloth, and the operation flow chart in our mind. Now let's start the highlight of the course. Include the 12 points. First, check supplies are available. The second, wet hands with water. And then apply soap to cover all hand surface. And then rub hands palm to palm. This is to clean up the two palms. And then right palm over left dorsal with interlaced fingers and vice versa. This is to clean up the dorsal of the palm. And then palm to palm with fingers interlocked. This is to clean the lateral of the finger. And the back of fingers, opposing palms with fingers interlocked and vice versa. And then rotational rubbing of left thumb clasped in right palms and then vice versa. And then rotational rubbing forward and backwards with fingers of right palm and vice versa. This procedure is to clean up the tip of the finger. And then we can rinse hands with water and dry hands with a finger, use towel or tissue to start to turn off the first aid. And I will show you all video. This is a hand wash stand for the routine life. I will show some pictures about my department. This is the SR room, and this is the corridor, and this is the holding bay, and this is the nurse station, and this is our anesthetists and the nurses. Thank you.
Okay, thanks for Ms. Zhou. And the last speaker is Ms. Dai Ronghua from the Department of Neonatal ICU. I'm sorry.
Hello, good morning, everyone. I'm Della, a neonatal nurse, come from Children's Hospital of Chongqing Medical University. Today, I want to share the topic about visit of premature infant after discharge in my department. I will present my content from the following three aspects. Data about prenatal birth in the world, premature birth complications and mode of post-discharge visit in China. From this picture, we can see prenatal birth is a global problem, not only in developed countries, but also in developed countries. There are some important facts from World Health Organization. An estimated 50 million babies are born prematurely each year, and the number is rising. Premature birth complications are the leading cause of death among children under 5 years of age, accounted for approximately 1 million deaths in 2015. This is etiology of neonatal death. We can see prematurity and congenital abnormals account up to 36%. Cost-effective existing interventions could save 3/4 of these deaths. Prenatal birth can result in so many complications, almost all body systems, heart, kidney, lung, eye, almost all systems. Are related to organ and system immaturity. In some cases, complications can completely return to normal, but in other cases, organ dysfunction can be left behind. So that is why we need to follow up premature baby even after they are discharged. Next, I will share the modes of post-discharge visit in China in my department. Firstly, every premature baby will receive special instructions regarding home care while discharged. The doctor is talking to baby's family members about the baby's hospitalization condition and how to observe baby's ambulatory conditions. The nurse is teaching baby's father and mother how to give massage. That is benefit for baby's nervous system development. Secondly, doctors and nurses will make home visits, but this is only for very low birth weight and ultra low birth weight babies. In this picture, medical staffs went to the baby's home to visit the baby, give some instruction. Baby height is very small. Gestation is only 24 weeks, and birth weight is 500 grams. The third type of follow-up is by telephone. We have a special system installed in our computer. Every day, a nurse will open the system and get the baby's information and call the baby's parents to know about the baby's current condition and instruction, give some suggestion. From 2015, we started medical and nursing integration outpatient service. That is different with the traditional outpatient service. Babies need to see a doctor, also need to see a nurses. They will together examine and check the baby's condition and give suggestion. With that, we also set up some chat groups for parents of premature for premature infants in order to facilitate the exchange of experience. Also, parents can write emails if they have any questions. Medical staff can give corresponding guidance. Finally, each month, we also set up special classes for premature mothers to teach them how to give routine cares for baby, how to keep breastfeeding successfully, and all other things. This is our premature teens. They are very excellent nurses and doctors together. That's all. Thank you.
Okay, thanks for everyone, and that's all for the presentations by our medical team. And Mr. David, shall we discuss all?
Yes, please. Thank you, and thank you, Dr. Wei, and thank you through you to all members of your team for excellent presentations this morning, giving us an idea of their specializations and what they do in their particular areas of work. It was very interesting for me, particularly certain parts. Some of it was more complex than my.
Yeah, I think so.
But all of it was very interesting. Some parts were particularly interesting. Dr. Kohal had mentioned the possibility of a discussion, but I think he has had to leave us. I don't see him here. I'm looking at the list.
He's there. He's there. Yes.
Okay, your thing was also.
There's another page.
As the floor is open, I would like to give the floor then to you. You're the expert in many of these areas, or you know a lot about these terms and so on. So I'd like to probably open the floor to you in the first instance to say a few words and any questions that you have or thoughts that you want to include. Mention was made this morning by Professor Robinson of the agreement that has been established, the MOU, which is a basis for future cooperation between the Faculty of Medical Sciences and Chongqing University. And we're looking forward to the implementation of that once the conditions allow that to happen. So, over to you.
Yeah, certainly. And once again, pleasant good morning to everyone. I will start off by saying to you and your co-director, David, thanks for the invitation to be a part of today's open house. I was able to sign in and pick up from the first presentation and all the presentations throughout by the fourth Chinese medical team to Barbados. And I reflected on the presentations, and I also reminisce on the opportunity we had to meet, face to face, as opposed to remote Zoom call. We are very happy in the Faculty of Medical Sciences to be one affiliated with the Confucius Institute, and also to now have formal affiliation with the Chongqing Medical University. The MOU has been signed by both institutions, and I can tell you very much that the Faculty of Medicine and also our student organization is very keen on exploring all possibilities. Interestingly, just after we had finished our deliberations face-to-face and would have started the process of signing that MOU, we were invited by the Chongqing Medical University to the same study tour, which was one of the presentations that were outlined. But unfortunately, that was early in the year when, the pandemic, COVID-19 was then declared a pandemic, and we would have had a couple landed cases in Barbados, which essentially would have prevented the students from traveling back and forth. So that impeded any opportunity for a physical face-to-face opportunity to share in that type of collaboration. But there have been a couple of updates. One is the Medical Student Association board has changed since the initial meeting that we would have had. with, I believe, the vice president and the president of that association making that meeting, young Miss Chiquila Hewitt, very passionate medical student on our side who has been a student of the Confucius Institute herself and would have benefited through training, especially in languages, among other things, at the Confucius Institute. So she's no longer vice president, but we have a new board in place, and we were able to have the MOU finalized by both institutions in time to pass it over to the new Medical Students Association to ask them to identify opportunities that they think we could explore, even if not in a face-to-face fashion, but in a remote fashion. One of the things I wouldn't want us to do is to see this collaboration with the Chinese medical team and the Chongqing Medical University being one where it can only be embraced in a physical setting. But there may be opportunities for us to have sessions like this on Zoom, Microsoft Teams and other technology platforms which will allow for sharing. So we are very keen on that. I can tell you that the region itself, as in CARICOM, the university across the various CARICOM states, and this campus is quite keen on exploring the ongoing relationships between China and this region, not only in terms of economic benefits, but also to provide benefits in terms of education and training. We see interacting with China an opportunity for sharing in a mutual way, where our students, our healthcare professionals can benefit by doing specialty training. We have had the opportunity of having some of our doctors who completed the MBBS program on our side to got a chance to go to Chongqing Medical University and the hospitals associated with the university to do specialty training. So we are looking forward to a long-lasting relationship, and we are also looking for some cultural immersion as well. My particular interest is in traditional, or alternative complementary medicine. As a pharmacologist, my focus primarily rests within herbal teas and other plants which have medicinal value. But I also know the other complementary and alternative traditional Chinese medicine approaches, acupuncture, cupping, along with the use of herbal remedies, which we could certainly learn from, because unfortunately on our side we still see that as unconventional or non-conventional, right? But I understand that on the Eastern Hemisphere it is very much conventional, and it, in fact, it is the mother of all medicine, because all medicines that we consider conventional on this side actually came from those very early documented sources of the use of plants being able to cure diseases. And we note that it was through these observations which led to the development of disciplines like pharmacology, where we are now able to identify compounds and attribute physiological effects of compounds on the body. So I myself, I have a lot of interest in pursuing whatever opportunities that may exist, not only for students to share, but for faculty to share in knowledge, and also for some cultural immersion as well. So again, to the Chinese medical team, thank you for your presentations this morning. I thoroughly enjoyed them, and I'm happy to have been invited to this session, and I look forward to sharing with you in the future.
Thank you.
Hello, good morning, team.
Okay. First,
Good morning.
I believe that the representative of the Embassy of China has some words to say, Mr. Zhou. Zhou first, and then Grafton.
Okay.
Zhou first. Go ahead, Mr. Zhou.
Okay. Thank you, David, and thank you, everybody. It's a pleasure to be here on behalf of the Chinese Embassy. Just now, I listened very carefully about all the speeches presented by the medical team. First, I just thank the medical team for your successful speech and a very wonderful speech, and that is very impressive. And although some of your speech is so professional and there is so lot of words which I cannot understand very clearly, but it's very useful, especially that Dr. Chow just now used your whole body as a tool to show how the acupuncture can be finished. And also the Dr. Wang Jing just show some pictures about our internal organ. It's very impressive. You know, we as ordinary people, we cannot see such pictures very often. So I think this is very wonderful ways to communicate with the doctors. You know, in China, it's very difficult to face so many doctors one time. So then now here you gave us the opportunity to face your all together in a one script. So that is show that your medical team is very professional and do a good job in Barbados, and do a good job to bring the bridge between the Barbados and China, and between Barbados and Chongqing. And just as Dr. Sui Wei just as introduced to us, there's some travel program which prepared for the participants. I think that Chongqing is a very good city, a very wonderful city, and I have been to there for several times. It's very, because my hometown is in Sichuan, is very close to Chongqing. So I like Chongqing very much, and it's also called a mountain city. It's a mountain city. Of course, it's not a flat. It's not as flat as Barbados. It's very totally different. So welcome all the participants. Welcome all the Barbados friends to Chongqing, to China, to visit after the pandemic. So this is the first point. The second point is after the pandemic breakout in Barbados, the Chinese medical team had to do a lot of contributions to our states, to the UWI-CH, to fight against such a pandemic. So I think this is a real action to finalize President Xi Jinping's as said that now we must build a common community with a shared future. Your actions, your assistance to the Barbados, I think it's a very on time. It's on time, and I think the UWI-CH also has a good communication with your medical team. So just as I said, your every member of your medical team just work in a different department of UWI-CH. So we can just exchange our experience, our knowledge in the different fields. So that is a very important aspect of the two countries' medical fields. And also, I just now, as the medical team said, you have signed some agreement to invite some Barbados doctor or nurses to study in Chongqing. That's very useful and very good job, because you can do this way. I think more and more Barbados friends can know Chongqing, know Chinese, especially know Chinese medicine, because Chinese medicine is very surprising, very magnificent and magic way, especially in this battle against the pandemic, the coronavirus, because in the fighting in China against the pandemic, we combine the Western medical ways and the Chinese medicine together. That's very efficient, very proved, very efficient. So I think we can just promote the Chinese medicine in the world, and we can do more jobs about this. And the third thing that I want to thank the CI, the Confucius Institute, and because your institute has, especially Mr. David, and Miss Lee, you do a good job, and you just show the Chinese culture, show to the Barbados friends, and also just bring the Barbados culture to Chinese people, Chinese friends, Chinese community in Barbados. And, so without your efforts, we cannot organize so successful forums, so successful meeting to online. So I think you are the good organizers. So our embassy will continue to cooperate with the CI to organize more good events for all the good friends who love China, who love Barbados. And thank you very much.
Thank you very much. Thank you very much, Councillor. Before I give the floor to Grafton, I'd like to make a few words in response to you to say, well, thank you very much for your kind words to the Confucius Institute, to Dr. Lee, and to myself. And certainly, like you, we want to continue the cooperation with the embassy. And part of our job is facilitating the contacts. Our primary job is teaching Chinese language and culture, but also part of our work is to help facilitate contacts for entities on campus and even beyond in Barbados to make links with China. So we were very pleased to be able to make that link between the Faculty of Medical Sciences and the Chongqing Medical University, which has a number of hospitals functioning there. And as we have made that link, we can sit back and see the cooperation develop in its own good time. What we're doing, in fact, is part of the university approach for internationalization. It is a regional university, but it has a global outlook. So the university has been for many years looking beyond the Caribbean, make linkages and connections to help enhance its programs here and to broaden the horizon of its students. In doing that, we are really part of a movement in Barbados, that the country is not looking only to the traditional sources, but it is looking beyond, and other countries in the Caribbean are doing the same. You can see, for example, in Barbados that we have a need in the area for nurses, we have a need for medical assistants. So we've looked beyond, and we've looked to China, we've also looked to Cuba, and we've also looked to Ghana, and I believe we will probably be looking further afield to meet the needs at home. So we here at the Institute will continue to cooperate with the embassy to explore the opportunities. In fact, the agreement that we have now with the Chongqing Medical Center, the Faculty of Medical Sciences, the university has with Chongqing Medical University, came out of discussions with the embassy, who, when we started the dialogue, told us, talk to the medical team and see what is possible. So it is through connection with you and cooperation with you that we have come to where we are today. Thank you very much. And I now give the floor to Mr. Grafton, who is a good friend of the Confucius Institute and is always there to support us. Over to you, Grafton. Grafton, you're there? Can you hear me?
Yeah, I'm hearing you.
Yes. Okay, over to you.
Okay. Yes, you can hear me?
Yes, I am. Yes.
Yes, you can hear me?
Yes, I am.
Sure.
Okay, yeah, okay. Good morning, everybody. My name is Grafton Problem. I was a proud member of the tour to China last year. I certainly enjoyed that tour to China. But this morning, I would like to carry on a point made by the ambassador when he made the point that that Chinese traditional medicine and Western medicine, they combine them to the best benefit to deal with various medical situations. And we in Barbados also have traditional African medicines that we can also look to as well. But what has happened is that a lot of Western medicine has somehow taken over. And there are people like me who are looking forward, who are open-minded, who are looking for the revival of traditional African medicines in about thousands of years to be useful in Barbados today, where we have some serious problems, diabetes, 1 in 5 Barbadians diabetic, problems with heart issues and strokes, and then we also have problems with cancers, prostate cancer in men, ovarian cancer in women. But the point I want to make is certainly we Chinese can offer some cooperation using all traditional or Barbadian plants and herbs to develop a pharmaceutical industry in Barbados using Barbadian herbs and plants and the knowledge that Chinese have of their traditional herbs. I am sure that some of the herbs that are found in China may also be found in Barbados, and some that are in Barbados may not be found in China. But certainly, we can have a cooperative chain of knowledge to develop Barbados to have a pharmaceutical industry where both China benefits as well as Barbados benefit. I'm very happy to hear many of the doctors and nurses here this morning. And I certainly look forward someday to visiting Chongqing's University or doing that tour because I'm a very keen student of Chinese language as well as Chinese culture. Thank you very much.
You are so welcome to Chongqing.
Thank you.
Microphone is off. Is off. Sorry about that. It would be remiss of me not to call upon an expert, a local expert in the field, certainly of traditional medicine, Dr. Che Corbin, as we are having this discussion, medicine generally, and specifically traditional Chinese medicine. I see Che. Are you hearing me, Che? I see your picture is appearing.
Yeah.
Okay. Would you care to make a few comments on the points made this morning and in your area of specialty, traditional Chinese medicine, and its applicability to Barbados and other Caribbean countries? Over to you, Che. Are you hearing me, Che? Che, I thought I heard a response from Che before. Maybe I'm not. Okay, Che is now there. Yes, Che is enjoying.
Oh yeah, yes, he's there now.
There now. Okay. Yeah. Okay. All right. Over to you, Che, for your comments. Che is enjoying the great outdoors. You can see he most of us here are homes, but Che has the great outdoors at his back. Best of both worlds. He was most recently seen on.
Thank you very much.
Okay, good. All right.
Good afternoon.
Yes, good. Nice to hear you, Che. Come in.
But you know, it's very interesting the connection between traditional medicine. And in this sense, all medicines have a strong connection because the Western medicine that we speak of now relies heavily on scientific advances in the last. All medicines traditionally have, because everybody is looking at the human body, everybody's looking at health from a human perspective. So there are quite a few linkages between the different types of traditional medicines. Also interesting to note is that even in the early texts of, for example, the Yellow Emperor's Canon of Internal Medicine, with its early publication, I think 2,000 years ago, they are talking about, within this text, they say that we are recording the health advice of our ancestors. So for people 2,000 years ago to be speaking about their ancestors and Gu Ren, there's a word in Chinese, Gu Ren. Perhaps one of our teachers can explain this more. Ancient people, Gu Ren. And so before the forming of nations, before the solidifying crystallization of cultures and people, so much exchange between the people across the planet that I believe, no matter which angle of traditional health one takes, we are learning that the knowledge of all of our ancestors.
Okay. All right. Thank you.
David, your voice mute.
Sorry, I keep turning it off and forgetting to turn it on. Che was last seen yesterday morning on the CBC in the morning. All about the Returned Scholars Association and his plans for the future. So thank him for taking some time with us today. Any questions from anyone else? I'm just
Thank you, David.
You're welcome, Che.
Always a pleasure to be here.
Questions from anyone else about the work of the Chinese medical team here in Barbados? Or if there be no questions, I would like to
David.
Okay,
yeah.
You have a question, Grace?
No questions. Yes. I would like to be here to formally thank you the fourth medical team, because several times our Chinese teacher have illness, they are not feeling good. The girl was hurt by a fish in the sea. We went to a medical team for help. Yeah, somebody said that in one life, in person's life, you should have a friend of doctor, a friend. You should have a doctor friend as your friend. That's true. Thank you very much for your kindness to us, our Chinese teacher especially, and also thank you for coming to join us today, for give us such a wonderful presentation, everybody.
Yes, I can echo Grace's comments, because I know if the teacher is far away from home, they feel very comfortable in going to persons that they are more familiar with when they have their medical issues. Not that they will not go to local doctors, but I know they feel greatest comfort in being treated by people with whom they have the greatest confidence and comfort. Any other questions or comments from anyone else in the participating audience at this point? If there be no questions or comments, I would like to, on behalf of my co-director Grace and all the staff at the Confucius Institute, say a warm thank you to the medical team for joining us today for our Confucius Institute Day celebrations. Thank you for all the presentations, to each and every one of you, Dr. Bay and the entire team, for all of the presentations that you have made. It certainly enlightened us about your work. I have one question for you before you go, Dr. Bay. How do you find life in Barbados? How do you find life? We heard a lot of work, but how do you find life? I know it is difficult being away from home. I myself have spent a lot of time away from Barbados, not as far as you are. How do you find life away from home? And I know also your your China, not just with the COVID, but even before that, there were issues affecting parts of your city and your region and so on. I know it must be difficult at times being far away from home, but how do you find life in Barbados? What can we do to make your life better here in Barbados?
Thanks, Mr. David. And actually, all of us enjoy the life here. And actually, at the beginning, we will have some difficulty, just because the language and the life here is so different from China, from our hometown. But after 1 year, we have many friends here, and we familiar with I think most of the places here, and we like the weather here, especially just because in summer, our Chongqing is the hottest city in China, so it's horrible. So we have 2 summers here, so we are lucky just because the COVID-19. So, and also, we think that the people, the residents in Barbados is so kind to our medical team and our the Chinese friends. So, sometimes when we met some the Beijing, and they just show friendly to us by Chinese. So I'm so strange to that. Where do they learn Chinese? Maybe that's the successful work by Confucius institution. But amazing that more and more Beijing know Chinese. So it's a good thing. And I think, just as Professor Damian has said, that the cooperation, the 2 universities and the 2 hospitals would promote in the future. And I think we have a bright future in the following days. Thank you. Thankful all of you.
You're welcome. Thank you very much too. You might have thought, in terms of the heat, you might have thought that you have come from, as we say here, from the frying pan into the fire. So Barbados is very hot at this point in time. You've come from one hot place to another very hot place. But thank you very much. At least you have the sea at your back door. You're very close to the sea. You can, you probably get more often than I do, because you were very, very close. All right. So once again, on behalf of us all at the Confucius Institute, thank you for taking the time for the presentation, and please stay with us for the remainder of the activities today.
Don't forget about Tai Chi performance.
Yes,
the
Tai Chi.
time
We're going to go into the Tai Chi once. Mr. Sawyer, we needed to make a change, so the Tai Chi will take place not this afternoon, but it will take place almost immediately once he is ready. And I need to hear from Sawyer. Samuel, I see a thumbs up, so I see Mr. Sawyer is ready. So I will hand over to him. What we will do, because we've had to change his time slot in the program, we will rebroadcast. We're getting very sophisticated now. We will have a videotape of his presentation, and if not all of it, part of it will be broadcast later in the day. But to facilitate certain logistics, we've had to change his presentation from afternoon to morning. So without further ado, I will hand you over to Mr. Samuel Sawyer, who will give a presentation on Tai Chi. Over to you, Sam.
Good morning, everyone. If you can hear me, please give me a thumbs up by clicking on the reaction button in the bottom right of your screen. Well, the physical thumbs up is good too. Thank you very much. This morning, I want to share with you a little of what I've learned from my coach in terms of Tai Chi. I'm not going to give you a lecture. I'm going to share some information with you. I'm going to attempt to reflect something of the range or the spectrum of what Tai Chi involves from the perspective of being a Barbadian interested in a Chinese martial art. So I want to begin by going into screen sharing and sharing with you a video clip, not from Barbados,